All right, so I'll go ahead and call the meeting to order. So this is the Concord Board of Health meeting today, Wednesday, November 20th, 2024. And we are in person and hybrid. Why don't we go around and just take attendance, I suppose, just for the record. So Randy Kring, chair, present. We have a new member here with us.
David Ropeek, honored to be with you all.
Excellent, thank you.
Dottie Bernard.
Portia Katie.
Great. And then some guests on Zoom.
Yes.
So thank you for being here. Excellent. So we'll go ahead and move on with the agenda. So the approval of minutes. So the minutes were sent out from last month's meeting. And I hope everyone had an opportunity to review who was present, and we'll go ahead and I'll entertain a motion to approve the meeting minutes from last month.
I move to approve.
And do I have a second?
Seconded.
Excellent. And all in favor?
In favor.
Aye, great, excellent. So the minutes are approved. Why don't we actually shuffle the agenda just slightly, just again for purposes of the record, the new member discussion. First.
Yeah.
Yes.
I will,
yes.
I can,
Yeah, go
so,
ahead if you would, please. Thank you.
Kurt Herman, been a board member for 2.5 years, moved to Carlisle. And because this is an administrative board, he's not allowed to be on it and serve on it. So we, made a recommendation to the town manager, and she appointed Mr. Ropeek, to fulfill the remainder of, Kurt's term. So his term was gonna terminate, in May. You could then reappoint. Usually you would then say you want to stay on, make the request, make the recommendation. You would be eligible for 2 full terms. But-
School me later on the process.
Yeah, well, I'm still learning the process, because this has been a new step for me, but, and Kurt couldn't be here tonight, but he is gonna come at our December meeting for recognition. We have a little plaque, and we'll give him a thank you, at that meeting, so he did respond to me today. And it will be coming then, just to recognize.
And I
him.
just served with Kurt on the 2229, what do we do with the hazardous waste site?
Mhm.
And he's very helpful, smart guy.
Yeah, he's been very helpful to us, and I'm very appreciative of his wisdom and insight on our well regulations, and also when I had specific questions on 2229 Main Street, as well as septic, when we worked on our septic policy. So that was a valuable, but he had to go move to Carlisle. So that exempts him from being on this board. So thank you. Thanks for being willing to step in.
Glad to be here.
I appreciate it.
Wonderful. Yes, glad to have you and welcome.
Yeah, I hope that my weird, a little bit out of the box experiences are additive and helpful somehow. I don't have the health experience, the legal experience, the things that people on the board have had. But I've been dealing with risk issues for the last, in my reporting days, and then for 20 years at the Harvard School of Public Health, and how to communicate about them particularly, and how people perceive them. So I hope that comes into use.
Excellent. Wonderful. We're very glad to have you, and thank you so much for being here. And we're very grateful to Kurt. We'll express our gratitude further at the next meeting. Absolutely. All right, so we'll go ahead and move on to the next agenda item, which is the discussion about mandatory recycling private hauler regulations. And we do have a guest present, Julia Green from Mass DEP. Actually, maybe Melanie, if you want to kind of give an overview, if you would, first of kind of how this came to be.
Yeah, I had a little bit of a roundabout. I working with the fire department on a couple of different things. And I was brought to my attention that we had a dumpster regulation, which I did not know about. I thought fire did all the dumpsters. In truth, fire permits dumpsters 6 yards or greater, mostly all construction. The Board of Health does have a very old dumpster regulation that we've not enforced, permitted, or done anything with in at least 10 or 15 years that I can tell. But it is technically on the book. So I started researching, okay, reached out to all my fellow colleagues. Do you permit dumpsters? Do you charge? What do you do? It's a mix, truthfully, of other surrounding towns, what they permit, what they do, why. I said, well, why do you do that? Which got me to looking on the DEP website about what is out there. As a Board of Health, one of our statutory requirements is to permit garbage and recycling haulers. So we hold and permit the haulers. So anybody picking up garbage in town, they're supposed to have a permit with our department. We review their licensure, where the waste is going, same with the septic haulers. Okay? And I came across this regulation, reached out a little bit to our friends over DPW and learned about Julia Green, who helps and assists over at DPW with our own town of Concord items. And just wanted to understand what the scope and possibilities were, a little bit about what this could mean. So I think that's all I have for now. There's a little bit more, once Julia speaks, a little bit more discussion I want to add to the mix, if you will. I'd like to introduce Julia. She has a lot of expertise on assisting municipalities with the choices and what their options for solid waste policy. Take it away, Julia.
All right, great. Thank you. Yeah, I'm a municipal assistance coordinator for Mass DEP. And there are 8 of us statewide, and I have the district called Northeast District 3, which covers Concord. I work out of the Bedford DPW at least once a week, and but I cover the whole area from like Framingham to Medford, all the way up to Lawrence and Lowell. So, and I work with municipalities on anything related to waste reduction. So I'm going to share my screen right now, hopefully correctly. And I think that's right. So tonight I'm talking about best practices for municipalities developing private hauler regulations. What was it? I guess I can trying to figure out how to advance it. Sorry. I'll be there in a second. Will that work? No?
Looks like, oh, there you go. I was gonna
Okay,
say there's an
great.
arrow at the bottom left.
Yeah, great. So, so here's my agenda. I'm going to talk a little bit about how we got here, making waste reduction a priority and the goals of the mandatory recycling and private hauler regs, and then the process that we went through, Mass DEP, in order to create hauler regs that work for both municipalities, the haulers, and also residents, and the results of that process, and then some extra benefits for the municipality. So many of you may be familiar with Mass DEP's solid waste management regulations, and prevention of pollution, etc. They describe and define procedures to follow to maintain health and safety standards for proper disposal of our waste. But you may not know that local boards of health have explicit authority over solid waste matters in the community, and here's why. So the basis for many of our solid waste rules originate from public health issues associated with how we manage our waste and discards. So as you can see, this picture of an overflowing dumpster, which Melanie was just talking about, but probably a century ago is when really municipalities started taking control of waste as a public health issue. So there's so many things around waste that we want to take care of. And one is, the stink and the vermin, but also the trucks collecting trash and recyclables and food that leak. And also, impacts from landfills that they can have on the aquifer. And now we're all learning about PFAS, the adverse impacts of incinerated trash on our air quality. And then methane gas, which a lot is leaking out of landfills nationwide, and which is 21 times more heat trapping than carbon dioxide. And then also just the energy used to manufacture products from raw materials is greater when you're using primary, resources, over recycled products. So it's in our best interest to enact, the sound policies and to minimize negative impacts, and maximize conservation opportunities. So one way Mass DEP does that, is to work through what we call wastebands. So you can see this big picture of cardboard. We have a waistband on cardboard. The first wastebands were enacted in 1990, and a lot of them were put in place in the 1990s. However, just 2 years ago, we created some newer wastebands. We had a commercial organics material waistband that went into effect in 2014, but really only impacted large food producers like supermarkets and large restaurants, et cetera. But in 2022, we lowered that threshold to a half a ton of food waste per week. So now even many school systems fall into that waistband. We also enacted waistbands on mattresses, and you might have learned through the municipality that you need to recycle your mattresses now, and the same with textiles. Textiles are now a waistband as well. But even with all our waistbands, we still have a lot in the trash. So every 3 years, Mass DEP commissions a waste characterization study. And what they do is they go to the 6 waste combustors statewide, and they take samples. And this is the results. So there's still a lot in the trash. In fact, our solid waste master plan for 2050 gets us down to around 10%. And if you look at this pie chart, other materials, 10.1% is really probably what the real trash is. The rest of this can be diverted and should be diverted out of the trash, but still landing there. So we're always working at getting more of these materials out of the trash. And you can see why we're so focused on food waste when you see organic material in this last waste characterization study was 30% of the trash. The goals, so we know we can do better. And over the years, municipal officials often reach out to me and other MACs colleagues for assistance as they work to expand recycling services for residents and businesses that are not part of a municipal program. So for communities with municipal transfer stations, they are sometimes competing with private haulers who provide curbside collection to customers. In other communities, there may be apartments or condos or businesses that are not served by the municipal program, but who wish to have recycling services. In some ways, Concord's new program where you're issuing carts, but it's a subscription program. It's kind of similar to competing with those private haulers as well, because unlike other communities, Concord's, you subscribe to it, where in most communities, it's a municipal program and it covers everybody or pretty much everyone in the community. So one of our goals is recycling access for all. It's bringing recycling to unserved populations. And so these are some of the listed ones we have. And then ensuring compliance with waistbands. And so that's supporting haulers to provide recycling when people want to opt out of recycling and they only want a trash cart. And also to create a level playing field for the municipal program or the transfer station drop off. In this case, it would be for the municipal program. And our goal is also to have all parties have the responsibility to make this work, to make recycling work by providing a package that is both effective and enforceable. So that includes the waste generators, the haulers, and the municipality. So here's a photo because I I know that you're rolling out a cart program. And this, the picture on the left is from the town of Swampscott. And they have 35-gallon carts. I think that's what you're getting for trash. And then there's a recycle cart next to it. And so that's a bundled service. And I'm going to talk about that a little bit more. And the picture on the right is just a cart at the curb, but it looks like it's from a private hauler. So private haulers, a lot of times they don't offer recycling because they need another truck and they need to take it someplace else. So it's just easy for them to issue just a one cart. And so Mass DEP is really like asking for help from the municipalities by passing private hauler regs where, they would have to comply and offer recycling to all their customers, just like all municipalities do. And some do it and others are less compliant. So talking about less compliant, it's human nature to seek out the path of least resistance, right? True for most people. Rules of any kind can be perceived as a hassle, or some choose to ignore them because no one is making me do it. But we all know that rules are there for a reason. So example, seatbelts save lives even if no one is watching. It's often about doing the right thing. We want to look at how we can close loopholes and get everyone on the same page. Local boards of health have the authority to regulate private haulers operating in their communities. And that's under Mass General Law, Chapter 111, Section 31A. But no person shall remove or transport garbage, offal, or other offensive substances through the streets of any city or town without first obtaining a permit from the Board of Health of such city or town. So, and many municipalities have gone through this process and have regs on the books, but some find them challenging to enforce. So we also find that residents and businesses who generate the waste may not know how essential it is for them to be separating their recyclables from the trash. Through this process, we aim to provide language that municipalities can use to harmonize efforts, support haulers who provide services and make it easier for customers to understand and participate. So here's a current snapshot. What we know, in recent years, health officials have started to require that haulers comply with the waste bans in order to be permitted. 198 municipalities in Massachusetts report that they have private hauler policies in place. Some of these are outdated and many find them a challenge to enforce. Common for municipalities from all corners of the state is to ask people like me, a MAC, and DEP for assistance with developing new regulations or updating their old ones. So that resulted in a constant effort to ID good language from various municipal documents. And we found ourselves always starting from scratch again and again. And just as an FYI, I checked it out, but I'm sure that that Melanie can also tell you that Concord doesn't have any mandatory recycling or private hauler regs on the books as far as we know. So back in so we went into a process, and back in 2015, Mass DEP decided that it would be beneficial to develop guidance on the private hauler regulations and mandatory recycling for municipalities that were trying to develop those regs and get the best language in place. So first, we enlisted a consultant to craft a package with sample language, and they hired DSM Environmental Services to help with that. And also, we also began to develop a template with sample language that municipalities could draw from as they work to craft the regs for the community. So what we wanted to do is create this tool for the municipalities and guidance on key issues that they can address with these regulations. So, and then municipal assistance coordinators, I wasn't there at the time, but like me, compile a variety of best municipal regs from across the state, and then DSM drafted model guidance. So after that, they took it to the streets or to the municipalities. And they had in 2016, they held over 120 meetings, and I was at one of those meetings with the city of Lynn to offer feedback and to help them revise those draft regulations. And then Mass DP went out and did smaller meetings with haulers and municipalities and DEP again to review and discuss before they finalized the package. So, and what we heard from the stakeholders was that it was essential to make recycling mandatory for waste generators, meeting residents and businesses. It's imperative that they know that it's required that they separate recyclables from the trash, and that municipalities should make recycling a permit requirement for haulers, and the municipality needs to help enforce mandatory recycling for waste generators because haulers do not want to police their customers. So it's important that haulers provide recycling as part of a bundled service for the collection of both solid waste and recyclables for each customer. This ensures that all customers have access to recycling services in order to be in compliance with the waste bans. So education is key also for waste generators, and both the municipality and the hauler need to work together to educate residents and businesses about expectations. So the results were is that we pulled together kind of a package, or what Melanie was calling it the other day, is a toolkit. And in that is general language template, optional language, and I'll get to that, permit applications, example and template, an annual solid waste and recyclables reporting form, recycling service exemption form for commercial generators, and then waste ban fact sheets for customers. So the document contains sample language that can be adopted as is, or it can be edited, or it can be used in conjunction with town-specific language to best address the circumstances in each municipality. It's just a user guide, and nothing in it is mandated. So, but the common purpose is to have a general template language that begins with this common purpose, sorry. And it's important for all to play by the same rules. So keep in mind that the big picture goals and impacts as we work to reduce waste. So this is some of the things that we care about: the waste ban regulations, environmental benefits, of course, of recycling are maximized, and this joint enforcement by both the municipality and the haulers. And that it's fair and equitable to private haulers operating in the municipality, all residents and businesses, and have convenient access to recycling collection. And all haulers are permitted to operate in a municipality, are in compliance with state regulations. It keeps them compliant. So there's also greater consistency across municipalities as more municipalities are adopting these private hauler regs. Just in 2019, we had 168. Now we have 198. And probably by the end of this year, we'll have more, we'll pass the 200 threshold. So municipalities and haulers work together to support both the goals of the Solid Waste Master Plan and the Paris Agreement. So key elements is to define residential and commercial customers. You can implement private hauler regulations for residential customers or commercial customers, or both residential and commercial customers. In mandatory recycling for all generators. So that means everyone who creates any waste should be recycling, whether it's a resident or a business. And then the bundled service requirement is to provide the residential customers with solid waste and recyclables collection at a rate that reflects the cost of both services. So what that means in a nutshell is if I call a hauler and I want them to provide me with trash, they're gonna say, well, we're gonna provide you with both trash and recycling. And if I say, I don't want recycling, they're gonna say, you have to take the recycling as well. You have to take the recycling cart as well as the trash cart. And it's the same price. There's no discount if you're only taking trash. And so, and then also to collect solid waste and recyclables from commercial customers unless proof of separate recycling services exist. And that happens a lot with commercial customers because they may have a recycling hauler who's taking away cardboard and other recyclables, and they're making money off of that, especially businesses that have a lot of cardboard. Cardboard's a commodity that's worth some money. It's important to include some teeth, such as fines, in addition to the option of non-renewal of the hauler's permit. And it's good to require data in renewals too to ensure recycling is happening. So if they can report what their tonnage is, that's good, and that's in the forms. So there's also optional language for food waste haulers and transfer station operation regulations, the labeling of vehicles and or containers, and the enforcement of mandatory recycling for customers and more. So there's a lot we can work with you on depending on what the needs are for Concord. And here are some sample forms that are in that package. I think Melanie has probably looked through them already. But we have all these forms ready to go. And again, you can tailor them to your program and how you want to implement the program. So it takes three. This is a partnership between the municipality and the haulers. Communication is a shared responsibility. It ensures compliance and effectiveness without excessive burdens. And waste generators must be responsible for their discards. So the next one is, and there's grants and assistance. So help is here, technical assistance from me, the municipal assistance coordinator. And also the municipality qualifies for more recycling dividends points when you pass private hauler regulations and mandatory recycling. So just by adopting private hauler regulations, we award an additional recycling dividends point, and if you enforce them, we award 2 points every year. And Concord already receives a lot in recycling dividends points, and they invest that money that they receive annually in a form of a grant into their recycling programs and their waste diversion programs already. We mainly work with the DPW on most of the trash and recycling. So, and that's it for me. I hope that shed some light on private hauler regulations, but I welcome any and all questions too.
I guess one initial question for me is kind of what do the towns around us do? And I on the website that Melanie sent out, saw the list of kind of the towns like Acton, for example. But can you speak to kind of, have you had any experiences recently with working with any of the towns in our area to do this?
Yeah, Weston implemented them about 2-3 years ago when they started their pay-as-you-throw program at their transfer station. And Acton is interesting because they have actually, well, both towns have actually also enforced them. So for Acton, I know recently their concerns were around larger multifamily rental housing buildings that weren't providing recycling, and people were complaining a lot. So that's when they started doing some enforcement with the haulers. And they are complying now, at least in those buildings where the complaints were coming from the residents, so. I know, now that you say that, I like, oh boy, I wish I had researched more in terms of which cities and towns have the private hauler regs as your closest your closest neighbors, but yeah, I
Well, and I
mean,
think to the, every town is different, of course, and
Yeah.
I've lived in Concord for 4 years and I still don't totally understand how the trash and recycling works. And of course, there's just a big change in kind of in the program.
right,
So I guess, one big question I had too, I know Melanie has discussed with Concord DPW. I think in my mind, it'd be important to first kind of understand the status of things in Concord. Obviously, there's not a policy for mandatory recycling. But kind of understanding, I don't know, I suppose like what percentage of our town is subscribed in the existing program and kind of how many private haulers there are. Do you have?
I have a
You
little
into
bit of
that?
it. I know
Yes,
that we've
okay.
gone from, the new program has had a lot of feedback, right? We've gone from 3,400 subscribers to almost 3,700 subscribers.
Mhm.
So increased.
So there is increase.
Okay.
There are
That's
some,
out of about 8,000 households.
correct,
That's a crude
correct.
where things stand.
Correct, and it's not, there is some feedback about the size of the toter, because we do have a 60 big toter and
For
it's-
recycling.
I think for
For
garbage,
waste, it's
for-
96 gallons.
it's very
For
large.
waste.
You will be an option to get a smaller one, and I think that's been some of the feedback from some residents that have, single, one or two people living.
So I pulled up the website for Concord. I may be reading this wrong, but it says 35 gallon carts for solid waste and 96 gallon carts for recycling.
yes,
96 for.
Yes,
recycling.
yeah.
Right.
So
Yeah.
the recycling is, and then the chair's breakfast was this morning and the representative from DPW mentioned that there were 45 households who requested smaller recycling containers. And so they, on the Concord Town website, they do offer a 64 gallon recycling toter.
That's
Um,
new.
Yes.
Yes, that is
new.
a kind of
Yeah.
response. I knew there was change, I
Yes,
just remember
yeah.
the size.
Yeah.
They're
Um,
too heavy, they're too big, they don't fit in my garage.
Right.
correct, and there's a lot of different reasons. I mean, it's kind of like doing a dolly. Like they do move and they're not difficult for me, but you do have to like imagine it doesn't have swivels. So you have to move it like it's so there's a little bit of driving skill
I mean,
involved.
with families with lots of kids, the complaint used to be that there wasn't enough
Enough,
space
right.
for recycling, so.
Correct, it's,
Yeah.
I mean, hard to make a program that reaches everyone's
Everyone.
needs
Yeah,
from
exactly.
one or two people with very significant low, to families that, I can fill a recycling
Yeah,
96 thing. And
no
Right.
problem.
Right.
My town, we used to be every 2 weeks and I was like burst. I would have
Yeah,
a second
yeah.
one,
Right.
for recycling.
I'm curious about the food waste, because that does seem to be one of the biggest issues in terms of like the policy. So, and I know you have the like,
We subscribe to a separate,
okay, that's what
compost
I was gonna
pickup, yeah,
ask is
green,
I,
yeah,
yeah, so we
and
don't.
and the town
offer-
doesn't even,
We
doesn't-
don't, the
there's-
town does.
to my knowledge, Concord does
Okay.
not offer.
That's what I was
composting.
gonna ask, is I
Yeah.
keep seeing, I'm like,
Yeah.
how do I?
You,
I missed
you,
that.
you call a private hauler and have them pick up.
Got
Right.
it.
Right.
But this raises a bigger question in my mind.
Okay.
And I mentioned it to you when we were having our informal conversation the other day, and Julia, please join in.
yeah,
My recollection as a reporter was the same as yours, that this issue of the need to recycle started when we were running out of solid waste disposal space. And that's the core goal still, as I read your priorities, that and the keeping waste off the roads and things like that.
well, I would
What
just
was-
add to that, though, that actually like, everything that's recyclable that you recycle now is a commodity, and it's sold at market, and things that aren't recyclable, it's because we would like to recycle them, but if they don't have a market value, then they don't get recycled. So there's a push and pull right now too, and there's a big movement in the country for what's called extended producer responsibility that gets producers to produce more things with either recycled materials or materials that can be recycled, because it's been going the way of producing things that are not recyclable, and we don't want that, you know, so we either want it recyclable or compostable, you know, something that can be diverted out of the trash, so.
And they're still
Right.
developing new polymers where you could mix the plastics. But that was a second question. I'll get to that in a moment. The first one is, I did not see on your list of why, I'm all for this in concept, recycling, good. But I did not see on your list of why to do this, anything persuasive about why it is a public health, not environment, health issue for Concord. We don't have a disposal site.
Mm.
We don't have the place where the stuff collects. We have generators whose waste is taken away to somewhere else. And we're all part of a system, so somewhere else is not something that we have no responsibility for, but has it come up, or can we discuss what is the public health justification for regulating what haulers do and then what individual citizens do? Because more than half have chosen not to participate in what the town offers. What would be our justification for saying you got to do this?
Well, Massachusetts has a waste ban. So what we're really doing is asking the town for help in helping us enforce the waste bans. You know, because they're opting out of recycling, but they shouldn't be opting out of recycling, because these recyclables are a waste ban item and shouldn't be in the trash. But back to your question about public health, it is a public health issue, of course. Trash recycling is a public health issue, because if we didn't have these systems in place, then we would really have some all kinds of health issues affecting people, which is why, you know, 100+ years ago, they began to create systems to either bury trash or take trash away, so that it wouldn't be making people sick. So it is definitely a public health issue, and it's also in the state of Massachusetts, under the Massachusetts general law, it's the Board of Health's responsibility to regulate trash and recycling. So, in waste.
David, for me, the incinerators, the byproduct, the ash still has to go somewhere.
Oh, and some of it's in the air, and I remember doing the sawdust burning thing, and could they collect all the emissions? There's no such thing as a way.
Right.
So I feel like, and for me, if we talk about equity, and so that ash tends to go places where people are more disadvantaged. It doesn't get dumped in Concord, right? But it does get put in a landfill, or in the past was, you know, spread or dealt with, you know, when it goes, it's there for in perpetuity, right, forever. So I think the motivation to clean up is a fundamental, like, society problem, like how we deal with our waste.
That's why I framed it as a particular Concord question. I'm
You
trying-
know,
I'm trying to foresee a question from somebody out there who hasn't chosen to participate in the town's thing,
is it,
knowing why.
well, I can't answer that question. But I imagine that, you know, would someone think that is their burden to take on
Yeah.
with society's problem of garbage?
Mhm.
The
For the
NIMBY.
costs and the inconvenience, but it is, I believe, fundamentally what DEP is trying to solve,
Yes.
Mhm.
right? The long, big picture as a society, as the whole Commonwealth.
Yes, yes, yes.
And Melanie, am I right that it's just sort of a historic, you know, allocation of responsibility onto local boards of health? You know, that we are the, and maybe Julia, that we're the enforcers of this, regardless of whether it's an environmental thing
See,
or.
you're segueing, I brought this was purposeful.
Yeah.
I did this is the responsibility of the Board of Health.
Well, right, so that's,
Okay.
so I guess to your point, it's like, regardless of whether or not a citizen feels like it's an environmental issue, it doesn't really matter, it's in our purview, so.
Yes, oh, absolutely.
Yeah.
And by the way, I read this with interest. I noticed that it was edited by and championed by the Conservation Law Foundation.
There is some bias in it.
Which is
It's not
about-
independent, if you're looking for.
Wonderful organization, but you can find the environmental leaning in a lot of their stuff, but it was very helpful.
I put this out there mostly because I have not the first person who's challenged, why is the purpose of this?
Mhm.
Not to throw anybody under the bus, but,
Mm.
and it's okay, that's good. I think that's a purposeful discussion, like, that was kind of why I was looking into, like, what is my responsibility with dumpsters?
Hmm.
Right, that was my original discussion, right, is what am I doing and why? What is the goal? And I think originally it was dumpsters to keep nuisances down, to understand where the trash was being. But now we're doing haulers, and this is like the next generation of. I can't say if it's a fit for Concord, I think, given I spoke to my colleagues in DPW. Given the pushback that has had, from this rollout of our rolling carts, if you will. It's not. It's a lot to take on to do this, if you guys were gonna decide to do this in the short term. It might be a more long-term project because of the enforcement piece.
Well,
So,
that's exactly what I wanted to talk about, is like,
cause
how
it's,
do you envision enforcing through our,
we would really have to talk to where, like, and is that a position? How is that gonna happen? All those logistics
Yeah.
are gonna be part of the you're not just gonna say, oh, we ban this and walk away,
Mhm.
right? I
Yeah.
don't think we would do that.
Well,
right? like the
Yeah,
blowers.
but I think, like, back to, the problem that DPW is having right now. So they have the rollout of the municipal program of trash and recycle cards, right? And actually, it's actually a great thing, because even though they can't get everybody their carts right now, according to Justine, who I've been talking with, they have, more success than they expected, because now it's increased to 3,700 people waiting in line to get into the subscription program. Most cities and towns don't have a subscription program. When they roll out a program, it's like everybody gets a card. Everybody, as long as you're so many, households in a particular dwelling, everyone gets one of those cards. I'll tell you, every time carts roll out in a community, people go crazy. And
Mhm.
they
Something
say the
new,
carts are too
something you
big,
never
the
seen.
carts are too small, I can't push a cart. And then what happens, oh, sorry.
That's some of the stuff.
Another-
Correct.
Well,
Yeah,
I
you know.
agree.
And
But
that
then
actually
what
may be
happens?
to our advantage, I think, in as far as regulating this, is that, I'm again pulled up the Concord Waste Disposal website, and let me find it now. Concord's curbside collection program is ratepayer funded. Tax dollars do not support the program. So the town is essentially functioning as a private hauler.
Right,
Right, I mean, and there's a kind of a tendency to look to the town to take care of your waste, but I think in my mind, we could argue that, well, the town is functioning as a private hauler, and so we should regulate the other private haulers so that they also
Right.
offer recycling just like the town does. And you
Yeah.
can't, am I correct that you can't opt out of town recycling? Right, I mean, you
right,
could
you
get
can't
the
opt out.
bin and just not put it out, right? I guess that's.
I don't know the answer to that.
But I
Yes,
guess
that's
to me,
true,
to-
that's true.
I guess,
Yeah.
Julia, the only thing that I'm like, from an enforcement perspective. If we don't, in my view, is like, if it's not compliant, the people picking it up, they just look at it, it's all mixed, they just don't pick up your trash. Like, in my view, that is the only practical way you could enforce it. But if we don't, do you know what I mean? Like,
Well,
like,
no, it
not-
wouldn't be that
not
difficult.
true.
You do the
It's
enforcement
messed
with
up.
the hauler. You do the enforcement with the hauler, not with the generator. So
Okay,
okay, so
basically,
that's confused, yeah,
yeah,
that's
so
where.
the
I'm
only
traveling.
enforcement is that you would be checking, like, for instance, if someone called up and they say to you, I'm subscribing with such and such private hauler and they are not giving me a recycle card. then you
Okay.
would go out and you would say, hey, you're not providing recycling and you're gonna lose your permit because of that. That's what the,
Okay,
that.
Got it.
It doesn't get down to the level of going to Mr. and Mrs. Smith and saying, you
No.
didn't put your bin out the other
well,
day.
maybe that's how we message it then to the public, if they freak out, it's like.
Yeah, I mean, like in my, when I first started thinking about this, I'm like, people are gonna be upset. Are you going through my trash? Like, I
Yeah.
don't want the town going through my trash,
Splitting
like,
open the
right,
garbage.
well, this could have been recycled,
There's
this could have
glass
been
and
recycled,
metal.
right.
Kitchen garbage.
But-
Julie, can you talk to me a little, just mention that enforcement, because you had explained it to me that it was at the hauling station. Is that true? Can you confirm?
Well, no, so Matt, so this is what happens right now, and it can happen whether you have private hauler regulations or not. So we have waste ban inspectors that go to transfer stations and they go to the waste to energy plants. And they go to the tipping floor and they watch trucks tip. And if a truck tips with more than 30% recyclables, then they issue a fine. And then the haulers are permitted to pass that on to their generators, and they do. So I've had a lot of towns call me and say, oh, this restaurant's complaining because their hauler passed on a fine from Mass DEP at the point at the incinerator.
But
So.
when you explained it to me, that's only in the towns that have a recycling bin. That doesn't happen right now in.
No,
Concord.
it happens with trash trucks. It's not even recycling.
Okay.
Yeah, it's trash trucks. So when the trash truck goes and tips at the waste combustor and onto the tipping floor and dumps out all the trash, if the trash is more than 30% recyclables, then that load is cited and fined, so.
It'd be hard to figure out.
Yeah, I wouldn't want the job of having
Yeah.
to figure that out either.
It's interesting though, because the haulers don't want to pay it, they always pass it on to the generators.
Mhm. Well, and just getting to Concord, does Concord currently have permit trash collectors for the town? So like
We have, what, 4?
Private, yeah.
private,
Yeah, didn't we find out we
Yeah.
have 4?
So originally when this rolled out, if you didn't want the town, what they messaged, they said you could go to the whatever's permitted, and we had 2.
okay.
So there's
You're
more than
talking
2
about
haulers out
The
there.
October new,
Correct.
Okay, all
So
right.
you could use the town, but you're not it's not required.
Right,
Right,
right.
you're not, it's not like mandatory because of the pay, so you can seek your own private hauler.
right.
And that, we only had 2 permitted haulers at that time. We now have, I think it's 4.
I think it's 4.
But is that every hauler in town? No.
Right.
But I can't go around and chase all the trash trucks.
Right,
and
right,
know.
right.
If I find out about one, I'll call them and say cease and desist, get a permit, right?
Mhm.
But that's,
So since October, the
We've doubled.
Board of Health has issued permits to trash collectors?
correct.
Okay,
It's not,
Right.
it's not a good statistic to say.
It's really an easy thing for Concord, I'll just tell you the town of Needham, they have private hauler regs. Now I'm remembering who to tell you about. And they actually have over 40 private haulers permitted. So they have a big job, but that's because they have a lot of businesses along Route 128 there and everything. So they have a large commercial base. And so they have to, and those commercial buildings all have different private haulers, as well as they have a transfer station. So a lot of people do get residential service as well. So, yeah, there are a lot of private.
There was one thing, Julie, that you mentioned in your model of how to go about it.
Hmm.
First, you said the idea of these regs is so that all the haulers are on an even playing field.
Yeah,
And that disadvantages a small business. That disadvantages a business that is not as able to buy carts and so forth. But then you said the cost all gets passed on to the
Yeah.
generator.
it
The
does.
hauler says, like the town has said to us,
Yeah,
buy the carts. So my question in my mind is, were we to do this? Is there any way of estimating so there's half the town has chosen not to pay into the
Correct.
town's
Not to
thing,
subscribe to the,
Roughly.
yes, yeah.
right? For a variety of reasons, who the heck knows what,
Correct.
right? Some of them may be cost.
Not
them
really,
may be
because
cost.
the private haul is
So,
more.
so what are the costs? What would the impact on a person in Concord be financially to pay the hauler to start to put them into the recycling mix that these regulations will
And
require?
these 4 private haulers that we have permitted as a department, do any of them offer recycling?
I don't know, I don't.
Because I think
Yeah.
that would be the first question, right? I mean,
So
if
I'd
they-
just
that
like
they
to,
do. I mean,
right,
Like,
to-
I'd have to look. Hold
Yeah.
on.
I'd like to respond to a couple of things that were said.
sure,
So first of all, the reason why why people are self-selecting into the town program, subscription program, because it's actually cheaper than what the private haulers in the area are charging. They're charging anywhere from $600 to $900 a year, and your program's costing 400 and something a year. So, so there's a lot, big savings. You may remember one private hauler that was operating in your area before. They were called Orifice. Do you remember that company? You'd see their carts around. And if you ever noticed, they always had both trash and recycling carts out because they provided both trash and recycling. I just want to make the point that they were a small business. And they always abided by the waste bans and provided all of their customers with both trash and recycling. Now they were bought out by Win Waste. So you probably see that it's now Win Waste trucks, the big red trucks that are operating. And I believe they also are following the waste bans. So some private haulers do, some don't. But generally, the private haulers charge a lot more than municipal programs, even expensive municipal programs. So that's why you're seeing people self-selecting and your subscription program is growing, is because there's savings there and people realize it.
But that's, the other half of my question is half the town hasn't.
It's usually because of this, like, I know when we moved, families said, oh, well, the Concord bins are
Right.
typically too small. Like, if you have a lot of kids, you'll never be able to, so that everybody I know who's opted out has been because they felt like they had too much trash for the
I bet
Concord.
there are a bunch of reasons, and that's a really good one. That's the one that my across the street neighbor had.
Yeah.
In my neighborhood, it's cost. Half the people have opted out purely for cost.
Huh.
They go to Acton where it's pay as you go. They bought a subscription or bags and they go to the Acton
Mhm.
station. Or, and I'm not sure, they've told me they take care of it themselves and within the
Yeah.
town, which I pretty is probably illegal dumping, and they go and they
Huh.
dump their little bags.
In a dumpster
somewhere.
somewhere.
In a
The town
dumpster
of Acton will
is-
be very upset to hear that there are people from
Yeah.
Concord going with their pay-as-you-throw bags to their transfer station, so,
Quite a few, I'm just, quite a few people in my neighborhood
Mhm.
now go to Acton.
So
yeah.
so a couple things I just wanted to add to the information, right? I know down the road there will be working on the DPW plans to work on a compost station, like that's, and to deal with that. It's just not on the purview. They're managing this rollout at this time. So that is like on the horizon, if you will. And the other feedback I got was they did not want it to be like, if we did it at this time, they felt that it would sound punitive, right? That if we're gonna pass, you don't wanna do our,
Mhm.
right, and that wasn't where I was coming from, but
Right,
I
right,
didn't,
right. The timing is
my
unfortunate.
timing
yeah.
is poor as far as bringing and having this discussion now.
Worse than that, we're gonna force you to do it with a private hauler that's more expensive. We're doing it to try and chase you to us.
Right, and that's
Well,
exactly
that's,
correct, and that was exactly
but
what.
it's because the private haulers are gouging is really why. The other thing is that just to let you know, in your municipal program, you can pay for an additional card. And it will still be cheaper than the private hauler who's only giving you a trash card, so.
Melanie, I know.
I
when you
think
were-
that people will learn more about your municipal program, and you'll have more and more people migrating to the municipal program because it really is cost saving, so.
I just wonder, given we have the benefit of a town meeting that's well attended.
Mhm.
When we were thinking about the nicotine thing, we had said, well, we could present this at the town meeting. I wonder if. At the town meeting. We educate people on this. Like, obviously it's within our purview, but if we're worried about perception.
I mean,
I don't know,
you
or
can do
like,
a vote, you
we
could,
could also do like an op-ed in the Concord Bridge, I don't know, I'm just thinking. Of creative ways to make it not be,
you could have a forum, you could have, there's different ways to like get feedback and input. I
Yeah.
don't, I have not gone down that road. This was
Yeah.
really just a preliminary discussion. And
yeah,
that's what I told my colleagues at DPW. I said, this isn't, we're not writing a regulation today.
okay,
You know, we're not passing anything. You know, we could do nothing. You could table it and revisit it. We could, you know, just,
What-
you know, decide to pursue. I'm gonna request that we put it after the 250th. But
oh, yeah,
like, so to
Yeah.
me, to like,
Yeah.
because of the capacity, and I do wanna have it be citizen involved. DPW to have some, you know, at least oversight, cause how is this gonna happen? We have to really think out like all the logistics. But I don't, and is it gonna be residential, commercial, like feedback on that?
Right.
Like, there's a lot of different,
Yeah,
Ton of different.
there's a
things to
lot of
consider.
different
Yeah.
things to sort through,
Yeah.
and I think for sure, we all felt, that's not something that's gonna happen. Whether or not it's a town meeting vote instead of a board of health reg, like, there's different ways to think about it.
yeah,
but I think
Clearly,
like without
Julia's
having the
model
private
that
hauler,
was Started with conversations.
Correct.
So that's what we'd have to do, and in a variety of places, but we'd have to have our ducks in a row first. We'd have to know how many this and the cost comparison that and what the implications would be, because those fora will ask questions
Yep.
that we'll need some answers about, which it sounds like we are grasping for.
Yeah, well, and I bring attention to the fact that it's 8 o'clock and we have more things to discuss as well, so.
And Julia
what-
wants to have his hand up.
Oh,
so-
sure, yeah.
no,
I'm sorry, go ahead.
yeah, I just wanted to add that, you know, again. You kind of handicap your program, even though it's even with private haulers not providing recycling when they should be, but they're not getting caught doing it. You're handicapping your municipal program that's doing the right thing by not having a regulation that creates the even playing field for both the municipal for the municipal program, you know. That's that's the last point I want to make. Trying to protect the private haulers for not recycling, and there wouldn't be a good idea at all, you know.
And by, I understand by us not doing anything, by not having a regulation, that is what we're de facto doing.
Yeah.
It's not by an action of the board, it's by an inaction, but,
Right.
so what I would ask, is that, you know, and then perhaps a straw poll from the board, who would be interested in pursuing this further, or if we should let it, not pursue it, versus pursuing kind of further information into this. So those is kind of the two options. So, those who are interested in kind of further pursuing this as something for the board to discuss, raise your hand. Okay.
Even if it's way down the road.
I just
I'm
have
with you.
request from my colleagues to push it down a little bit.
Yeah.
Cause we've got a
Yeah.
lot of things, like I also, you know, when I tell you my report, like we got a lot of things that are in the next 6 months. And we do wanna discuss with people and have input because of the feedback about the current setup.
In a perfect world, it would have made sense to do this before
Correct.
the rollout of the new system. At this point, I think we need to wait for the dust to settle with what has been implemented and then kind of get an understanding of what the new normal is before kind of looking at what we need to do to modify that.
In your ongoing work, as it fits in, since there's obviously no urgency, it would be good to collect some more information about some of the questions that came up. How many do, how many don't, the price differentials between
Right.
town and not, just kind of a little bit of, whenever this comes back up, more foundational information, no rush.
And
That's.
And to echo your thought, you know, a big question in my mind is those four private haulers that we do permit, do they offer recycling? Or do they not? And if there's a way to figure that out.
Well, we can find that out.
There you go.
Right now, the problem is they're all due for renewal, so they all
see.
expire, so. There's only. It's
One of them
Casella.
renewed this morning.
Right,
Okay.
so they're.
We have nice forms that
Casella.
you could use.
We have.
You
an
don't have to have
online
the private
permitting.
hauler regs.
Yeah. We have 1, 2, 3, 4, 5, 6 that are issued due for renewal. But I don't think
But one of those.
the bottom two didn't.
Yeah.
I don't think they renewed last year. They've been due for renewal for a year.
No, Stericycle is the one that renewed this morning.
Okay.
Metrano, I don't know about.
And in stepping way back, do we need to do anything for the fire department request about dumpster permits? Cause that was the initial question, right? Is,
Well, that was where I started,
Right, right.
honestly,
Yes.
like not.
And
That's that's how I got.
this, we obviously got down a long rabbit hole.
I
Is there
did.
an
It was a rabbit
immediate
hole.
kind of initial request of the board that we need to?
He just asked for my list of permitted dumpsters and I said, there isn't one. 'Cause
Okay.
none of them, it's not even built into the system we have for permits. We've not permitted them. I think since 2011, I can't tell.
Mhm.
So.
Why did he
I-
ask? Did he say what his interest was? This is a fire chief or?
This was the fire inspection.
Okay.
We were talking about fire prevention. And we're gonna co-inspect the mobile food establishments. And then we were talking about trash and haulers and I was like, you guys do it. And he's like, no, here's your regulation.
Mm.
And I was like,
No, you do it.
I do.
So fire,
Yeah,
fire has a proximity.
they have a
What's in
proximity.
them and all that stuff.
And I found out about when they did it, and actually the archivist helped me research, there had been some fires in dumpsters in Concord. There's some materials that do spontaneously combust if you're redoing your floors.
Mhm, mhm.
In those chemicals, and they put them in the dumpster, and then you have the house burned down because it caught on fire. So they make them be farther away from the house.
Giving rise to the truth to the phrase, you're such a dumpster fire.
Uh,
There you go.
There we go. So I could, and I haven't, like, my first solution was, well, rewrite the regulations, cause that one doesn't, we're not even using that one.
Mhm.
It's basically everybody needs to have a permit, and what do I charge them? I don't even have a fee. I could continue as status quo, B, next month we discuss and do like, what is it, where put it to sleep. Right? Or C, I go ahead and start, making people. That way, I'll know who their haulers are, because if you have a dumpster reg, that's one reason why you do it, is then when they apply, they tell you who their hauler is.
Hmm,
And then when you know who the hauler is, you make sure they offer, do you recycle? Do you have recycling?
yeah.
And you have to have a permit with the Board of Health. That's how you would know and make sure every hauler was permitted, and that does also make a level playing field.
Melanie, how, do you meet with this person again monthly or something, this
No,
fire person?
no, it would be,
Wondering if you could get a sense with all the other stuff you have to do. I'm new to this, I'm dumping stuff, I don't know how this works. Just get a sense from him about how much of a fire hazard he thinks it is and how much it needs to be paid attention to, how urgently.
he wasn't concerned about it at all.
Well, and we clearly haven't permitted dumpsters and,
We haven't done it in
Decade.
15
yeah,
plus years at least.
But it didn't come up because, oh my God, we have something that we have to worry about.
We were discussing regulations and enforcement, and I was like, these dumpsters, I would like to see who your haulers are.
Got it.
Oh, so, okay, just service.
We were
And
talking
then he
about,
was like, that's not my problem.
correct,
Okay.
you actually permit them, and I was like, yeah, it was just the original regulations from this Mass General Law with permitting haulers also connected the dumpster permits. And you did, many towns around us did. So I did a kind of a survey of the colleagues and do you tolerate dumpsters? Why? How much? $50 a year. On another municipality I worked in, bigger city, I did draft a dumpster regulation, and I know what not to do.
Mhm.
Cause that was not about requiring pest control and inspecting them. It was a bigger city, but but is not an easy task for enforcement and took disproportionate amount of time for what we
Mhm.
were doing for risk for human health, like,
Right.
like.
Yeah.
So and it was mostly on all the businesses, so that is, you're like chasing, businesses.
Well, why don't we table this for now? So I'm in favor of moving on with the meeting, but Julia, thank you very
All
much
right.
for all of that information, very helpful. And we'll, I'm sure, be in touch as more questions arise.
All right, great. Thank you.
Thank you.
Thank you.
Have a good night.
You too. All right, next on the agenda is the chair and board member reports. I don't have anything in particular as the chair to report. Anything from the members present?
No.
Okay, all right. So why don't we go ahead with the public health nurse report?
Yes.
You're doing that for more.
Maura is not here tonight, so I am giving it in her place. For October, we had 2 cases of Campylobacter, 2 cases of anaplasmosis, 9 Lyme, 12 COVID, 3 latent TB, and 1 varicella. The TB cases are, one of them is a class B recent arrival. 1 case was caught on a screen and connected to care. The varicella, it's chickenpox, was an unvaccinated infant who was exposed to their father with shingles. So, that is that. Maura wanted you all to know that she saw her first confirmed case of influenza A that came through in 11/12. So, believe that here we are with influenza A, we're into the season. Total as a town between COVID and flu, we gave 470 vaccines.
Great.
In the month of October, that was for the employee clinic, the council on aging, clinic, and at the shelter. Maura's been working with the Emerson's Community Benefits Group. She's in the mental health group. As part of that, we planted some yellow tulips out in front of the Beatty Center that we're hopeful that will be yellow and beautiful in the spring. I also ordered some tulips because we're gonna put them in the boxes at the council on aging. So I'm excited about that. There is a subcommittee of our behavioral health collaborative that is a health communications group that is meeting, and they are working on all things health communication. If anybody is interested in more of that, you can follow up with her.
Is that with Maura?
It is Maura, yep, and it's meeting at the library. Ricky Soros, the assistant director of the library, is the one that's actually chairing that. So working group that came out of our behavioral health collaborative. As a need in our community and how to reach folks through health communications. Any questions on the nurses report?
No.
Okay.
So let's go on to the public health director report.
Okay.
Thank you.
Sorry. In your packet, I did put a copy of the legal handbook just for your reference. I didn't print it out. If you'd like a printed copy, Ariana asked me and I said, no, we're not printing that. It is uploaded in the packet. You can download it, save it. It's a reference.
Great bedtime reading.
Yeah.
Oh, yes.
I mean, that way it's searchable and you can look for things that you're looking for.
The table of contents was very helpful.
Right. And there's a little to your point, David, there's little sub references to different things throughout that
You can throw it into chat GPT.
they're a little bit subtle sometimes, like in the last paragraph, it's like, oh, that's actually a commentary, there's a few things in there. Once in a while, you'll be like, I had a packet and then I added to it this morning. It's on the digital packet, but I also provided electronically. I went to the Mass Health Officers Association annual meeting last week in Springfield. And DEP rolled out their best management practice for usable containers that day. I went to the presentation. why it's relevant to you is as a board, we have one of the most special variances at Deborah's next door for reusable containers at takeout. So bringing back your home container for refill at retail is technically against the code. But this board has a variance for Deborah's to do that. But then this is, so we participated in, and so did Jill, in some forums that Recycling Works and me at Mass EP had. I've participated in nationwide forums about discussion about, because it's a conflict between the food code and all the environmental DEP, EPA, like less garbage, right? Well, everything food is garbage, every takeout container, everything is plastic. So this came out, I'm going to send it out to the food businesses, but I haven't yet, because I'm recovering from the training. I did yesterday, Monday, Tuesday, Wednesday, I also did the ICS Incident Command 300, which is the how to run a emergency incident for managers. And it's, so I'm kind of a little bit behind.
Can I just ask for this?
Mhm.
So is this best practices talking about allowing reusable containers for business? So sending this out to businesses
It's
like.
a
look,
little
this is
bit
something you
how
could do?
to be still in compliant with the code and do this.
So there is a
One,
way,
you can subscribe
okay,
to, you can have a variance like we
Mhm,
do, you can
right.
subscribe to a third party. You can have people drop them off and wash them yourself. But it's not to be in compliant with the food code, it's just ways and ideas to do it. Okay,
And Deborah's. Help me here, guys. Who else in town would have people coming in with their Camellas that's not,
so
Starbucks
yeah.
allows
Oh,
for
you-
oh,
personal
the-
cup
the
of
mug.
coffee.
that's in the code though, you can refillable hot cup, that's exempt,
Okay.
that's separated.
Separate, cold cup, okay,
What about Concord Provisions? They might do something like,
they don't.
they wouldn't do a.
No,
No.
they, to most
Not correct.
people, there's one business, the olive oil company, she reached,
oh, yeah, yeah,
I spoke to her about it, I went and visited her in person actually and said, you could do this, I would allow it, hint, hint. But that's on her as a business,
if she
right?
wants to, yeah.
just wondering how widely you would need to disseminate this.
I'm gonna give it to everyone.
I would just have,
I do think that there is like a concern about at least the black containers from a health perspective,
So
so.
one thing, this is really, we're taking out skeletons tonight. So Concord has a polystyrene ban,
Oh,
right? That is polystyrene, ban for takeout containers, polystyrene ban for sale. So anything in Concord that's takeout is supposed to be not polystyrene, so styrofoam number 6. There was, prior to COVID, a large list of establishments that had a variance for the Board of Health. So it's banned, then they allowed in the letters and on. And I found out this when Gabby, her last day, she gave me that, oh, this is, and I didn't know.
This was a prior health director,
Yep, no, the prior food inspector.
food inspector, okay.
So
Yeah, like a pre-
I've been working with a sustainability director for the last few months I need to send out a letter that says, hey, and I'm gonna do it after the 250th. I'm gonna send the letter out, hopefully the next month or two, give everybody 6 months to A, use up their stock, B, apply for the May Board of Health meeting for their variances.
and
And
specifically for
polystyrene, okay? Because Concord has a water bottle ban, again, solid waste
Yeah.
reduction, so we have kind of have a history of doing stuff for benefit of plastic, solid waste. But it's not being enforced right now. I didn't know about it and I didn't know about this list of variances, so we're going to be re-implementing that.
okay.
But I'm gonna give people till after
Yeah, yeah.
after the time. And the list was like 20 or so places that had exemptions for why.
That's all of them.
And so.
Yeah, really.
I guess I feel like, and a lot has happened in the food industry and packaging since then, there's a lot,
Yeah.
and
So
so
it's not as much of a hardship. right?
Yeah.
it may not, I don't know, so like,
That's right.
it'll be
That's
we'll be fresh eyes, it'll be like, okay, what are you saying that you don't want, you can't use
Yeah,
an
yeah.
alternative for?
Yeah,
Versus when they originally passed, there wasn't as many alternatives,
Mhm.
yeah.
legitimate, like, well, what are you going to do? One example is the hospital and their food service, like, and you go up to the rooms, they have the lid. Everything's washable, all the dishes, except for the lid that goes on the drinks, that's polystyrene,
Mhm.
right?
Hmm.
That was one of variants I saw,
Hmm.
right? So so I'm gonna send this out, and I'm also gonna mail out the letters that say, by the way, we have a polystyrene ban, and we're re-bringing this back.
That makes sense as an FYI, but yeah,
You know, and
That's why,
so
yeah.
that was kind of my goal,
That
but I
makes
was
sense.
presenting
Gotcha.
this to you tonight as the plan, that's my plan, I had to figure out the plan. Get
No, but that
sustainability,
makes sense to issue them together.
sustainability on, and I was waiting for DEP, I knew this was coming,
Yeah.
I just didn't, it took them. And I, with the sustainability director, cause he's relatively new as well, cause there are a couple people that are looking to do some other. You know, not put a plastic fork in the takeout, some reduction techniques and policies, to sustainability committee, so. That's kind of like where I'm headed with that, so I anticipate those variances coming through, and then we will start. During the food inspection, also enforcing that, but not till. You know, after
Yeah.
I've given everybody time and notice and.
Yep.
You know, all that.
and just with this, so that a note on the food code, basically it says the Board of Health is the best resource to ensure reusable containers are being offered and utilized in accordance with public health standards. So to clarify, you can use reusable containers and that can meet the food code. The food code doesn't say you
Correct,
can never
they
use
have-
reusable containers.
Correct,
Okay.
it says, this is what can't happen. You can't come into the restaurant and say, refill
food in
this,
this,
put my
right.
food in this.
Yeah, right.
Okay, as a food business, I
Can't do that.
can't touch it.
Yeah.
Okay, sometimes. What I could do is give you your food and then you put it in your own container and take it
Sure.
home.
Right.
That's one way. Another way is you have a container, and because what I can do, which no business wants to do, is take it from you. Take it in the back, wash,
Wash,
rinse,
right.
sanitize it, and then bring it back.
Right.
That's what the code says.
Forget it.
Yeah.
Nobody's
right, right.
doing that.
Yeah, yeah.
Like, I don't think.
No.
Yeah.
But couple of these programs are you buy and you turn it to a bin. I did this at Tufts when I was in
Okay.
Medford.
Sure.
And of course, it was a student close population, different model, right? But you brought your food takeout and then you brought the container back and dumped it, and then they washed
Wash
them
all
all
the
together.
containers, yeah. that
right?
makes sense.
Some of these have a third party that does this for you.
Okay.
There's
all right,
some
that's good.
communities that have a third party, and a number of businesses in the town work together, and it's all the same, you know, pink container or whatever, and you can bring it back to any of these businesses. But you pay like $5 for this container,
Mhm.
because there's a cost
Cost,
associated with it.
Yeah.
Dottie, you go back far enough to remember when we brought our soda bottles back to the wooden thing next to the soda vending machine,
It's,
right? So
it's,
you drink the bottle, sorry.
it's
look at
kind
you
of going
youngsters.
back to the fifties.
What? You would get the bottle, first of all, soda didn't come in cans, so that's, okay, so that's
Yeah.
how old I am. But you'd get the bottle, Coke bottle, right? And you needed to open it at the machine, cause who had bottle openers at home?
Mhm.
You drink it and you would return the bottle into a wooden crate with little sections that the bottle would go into, and they were all rewashed, and that's how we got our bottles back.
Yeah, it's like the milkman.
Yeah.
And that's what you, and that still could happen. You could return it, get it
Mhm.
washed,
Okay,
and
that makes
the
sense.
business has to have the space,
Yeah.
time, that,
Right.
in
And-
those,
And it attracted vermin and.
Oh
my God.
Right.
yeah.
Right, yeah.
So.
Again, it's.
Yeah.
Isn't there a risk that the glass bottle's gonna break?
It was
They were
like a
thick,
hand grenade.
Yeah.
It was like a brick.
So I'm gonna keep moving on.
Sounds
Yep.
good,
So
yeah.
that's the plan
Okay.
with like reusable recyclables
background
and
was very
tied into
helpful,
this, okay?
Sounds good.
And then, Massachusetts, this is I've been getting, this is update number 22. So I get these about every week. This is from, MEMA, Massachusetts Emergency Management. And the last 24 hours, for example, there's been 17 fires in the Commonwealth, burning approximately 270 acres. November, it's 403 fires with 1,036.
Wow.
Really of relevance, to us, on page 4 is the drought status, so it is important, we're in critical drought, almost the entire Commonwealth. And there is a good link in the digital, to folks about asthma and wearing a KN95 in their air quality, in here, that I probably will put out. I saw this today and I will message through that. There's some good links about air quality and what to do on page 11. So I'm just kind of like bringing that to your attention that we're getting notifications. And I intend to post something about that. We haven't had, like, I live in the North Shore, we've had a lot of smoke every day. I haven't smelled or known, yours is the first comment
Yeah,
I've had
today was
about
the first day.
smoke to respond to this,
Mhm.
right? Cause there hasn't been smoke. I think there has been at least one fire, Concord fire responded to, but it wasn't significant. Any comment, any questions about that? This is updated to our respiratory virus communications flyer that our regional health communication specialist did for the holidays. That we are going to post and put out on social media about just reminding everybody about general hygiene and safety precautions.
Excuse me, Melanie, when you say put out on social media, again, pardon my naivete in holding you guys up. What does that mean? How many people will that reach?
Probably not enough. David, you have ideas? You can-
Well, does it go through the towns?
It'll go through
Twitter
our, yes, it'll go
pages,
through the town communications.
Insta and all those places?
I don't know the answer to that.
So that would be the town's communications
Donna-
director person?
Donna McIntosh.
Who I've talked to about the 2229 thing, so I might ask her about that,
Yeah,
if you don't mind.
yeah, please do, because I asked her and there's people, you can subscribe to the health stuff, but I don't know how many people subscribe to that versus the general knowledge. And when I did our needs assessment, and then I asked our own board members, did you get it through the town? They didn't. So like somehow we're missing, and that is a really big objective for next year, is for us as a division, the health department, to figure out how to communicate with the
Social
public.
media is a passive medium, you gotta ask for it. It doesn't get pushed to you, right? We get
Yeah.
the bridge, cause somebody delivers it to us, you gotta log on to something to get to something.
Yeah, the bridge is like the way everybody's getting their.
Town.
Well, I may proactively send this to the bridge.
There,
great.
I mean, I will tell you at least, I don't know about you, but. Everybody reads the
Yeah.
bridge
Yeah.
now, right?
Yep, I
Yeah.
agree, yep.
This is terrific.
I mean-
I started it.
Did you really?
Did you?
Researched it, started the foundation, got the nonprofit status from the feds. Created a board, was starting to fundraise, and there were some conflicts between people that led a couple board members to take it away from me, sorry, and do their own thing. Thank God, it sort of spared a lot of the work of the actual startup.
Yeah,
But the first 2.5 years of everybody was saying we need it,
yeah.
and I'm a former journalist, so I got it.
Oh,
I pushed the snowball up the hill and it was only a snowball. It's now the bridge. It's way more than what I had in mind, but yeah, I'm thrilled.
oh, that's great.
Yeah, it's thrilling.
That's awesome.
Yeah.
Wonderful.
And having a relationship with them.
I-
Celeste, the editor, Erin, the reporter,
And
no,
the new-
Daytona, the new, town.
Dakota,
Dakota.
the new town
I
reporter
met him the other night.
is my new
Gung ho,
contact.
yes.
He,
He would love this.
so I could do, that is a good suggestion. I like that feedback. Add it to our list. Thank you.
Yeah,
I-
your lengthy list.
Yeah, so this is what, I mean, you're part of the community. I try, but this is great.
Yeah.
Cause this has been one of my feelings, like, what am I getting, especially with the needs assessment?
Mhm.
You're not
Yeah.
getting to people like I think I am. So how do I improve that? Right?
Well, and even like Instagram and nobody's really using that anymore.
And
Not for this.
The-
Well, and in order to get this, you'd have to be following the town,
That's what I mean.
right, the
yeah.
Board of Health, but as
That's
you
the,
said, right?
that's the
Yeah,
passive
and so-
nature of it.
Yeah.
To be continued about outreach, but
Yeah, the police department has a Facebook. We don't have a Facebook page. We never,
Nobody will read it.
it.
I wouldn't.
You're crushing me over here.
I just think Facebook is sort of like,
Yeah,
Yeah.
people aren't using it. as
Yeah.
much
Next
as they
pandemic,
used
they
It's all
will.
about the Instagram.
Yeah.
these
They will
days.
use anything they can find to get information, including the
to. That's
the
true.
Concord
actually.
Public Health Facebook page.
That's true.
Yeah.
actually.
well, that's good, and it's good feedback for this health communications group, because that's what has come out of some of our. Is how to reach the community correctly with our friends at the library, and they have So we're kind of,
The real answer is all of the above.
Yeah, that's
Right, right,
true.
yeah.
so then I need a systematic plan, like when I have something important to say, boom, boom,
How
boom,
do
boom,
you
boom, 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 this is where
distribute it?
everything goes.
Yeah, and
So,
some of those metrics are gonna be age specific and you would use different media,
Right.
et cetera.
we put things out in paper mail through the Council on Aging, like we do things like that.
Will these go up at the library?
Yes, they do.
That's good.
Maury's in good contact with the library.
Excellent.
Just real quick, we're getting late here, a couple other things. We permitted last week the Dunkin' Donuts right there on Elm Street, so
I
that's
know
now
it.
Have you
open.
been?
No, but Lenny's asked me like every single night.
We
When
went.
are we
Do you
going?
live near there?
Yeah,
We're neighbors.
Where do you live?
On
Where-
Elm, like right there.
We're right across from Numero.
Yeah.
I'm on Baker Avenue off Elm Street.
Oh,
On
you're
on your
so
card,
close.
yeah.
Yeah, I'm really psyched for the Dunkin' Donuts with Sally's a Pizza, which we tried in Burlington, was very disappointing.
I know,
Oh,
I'm
that's
from
too
New
bad.
Haven and.
Oh, my God, Pepe's and all of them.
Yeah.
Just reserve, maybe you'll be surprised.
You
I hope
never-
so.
Yeah, you know.
That's-
The 250th, we've been tapped as a division to work on the food needs, so I'm on the sub working group for the food trucks for the 250th with Elizabeth Hughes. And the team of town people, residents that are working on the food needs for the 250th. As well as recently this week, dealing with the most critical issue, which is the portable toilets.
Yep.
And the sanitary needs, which include hand washing.
And
that
can-
will come
remind
back.
me, like, what do we expect the total?
Nobody
amount
knows.
of-
So
Nobody
that
knows.
is the $1 million. If you could answer that question for me,
Okay.
portion of that, my job is to
Yeah,
pulling in toilets would be easy.
yeah.
Cause it's about,
How
well,
many
it ranges
people,
between
right.
50 and 100 per person. So if you have one toilet per 100
Or-
people, is kind of like the biggest, most. You could go less, you could do one toilet per 50 people, but. But how many people? So how many toilets?
Yeah.
Right? And you don't wanna have,
Who amongst the the high and mighty wants to use Concord as a political platform and show up for that day?
I-
Well, that's.
Because a
Right,
few years
that'll
ago,
make
it
a
was the
huge
president of the United States.
No, I
That
know.
kind of raises your pot of pork.
he's
Porta
not coming
potty.
to a porta potty.
Yeah.
I'm sorry. But there is
Yeah.
a law of, with the food and all the sanitation and the needs.
Oh, my God.
The number of people is like the big X factor, that you're trying to not overspend the town resources, but also meet the
Be
needs of the
prepared,
community. So that is the $1 million question,
Okay,
that I don't, at this juncture, have an answer to. What I'm going to do is what's called, right now, it's called a guesstimate. But I think
just look back 100 years.
it
ago.
could get down to what,
I was at.
I was thinking,
I was at the
1976,
1970s.
where the kids stormed the river, George Bush and all, no, what,
No.
Ford,
Ford.
yeah.
Yep,
Yeah,
I was
that's-
right there
Oh, my God, cool.
at North
Wow.
Bridge,
That's
yeah.
really cool.
But it was a party and it was all,
and there's no
uh,
toilets, I
us-
heard.
And there were no toilets but no one cared. It wasn't a
We were
big thing.
peeing in the river.
It was
I was
everyone from age
imagining that.
17 to 24. That cohort now is our age and they're not coming. So anyway.
Hmm.
Who
The
knows?
security, would the security committee that's working on things in town have a closer to guesstimate?
Not yet, that they've provided to me at this time.
They welded the manhole
That's-
covers shut. That's the only
They
thing
will
they
be
did
doing things
Oh,
like that
really?
as well.
on Main Street. That was the only thing they did.
There would be, there will be some things of that nature as well. I don't know the answer to any of those. One of my main questions will be how many people?
Yeah.
Just some other fun things. Tomorrow I'm giving chocolate chip cookies at the COA. I'm teaching a cooking class.
Cool.
The Elliott supervisor has reported that our mental health clinician position has been filled. So we had, through our behavioral health collaborative, kind of identified the need for a mental health clinician, and we did an IMA with,
Yeah.
Elliott Services last spring. We have had the money in the budget, but not been able to fill that position. This position is gonna work just for town, Concord residents, and be a immediate mental health clinician service. So if you are in crisis and you need a clinician, boom.
And the
there's somebody-
police know about it and all.
Police are gonna know, the council on
Emerson.
aging, school, everybody's gonna know.
Awesome.
It won't be their long-term care, so the goal is for them to then transition, but right now you could not be able to get into a clinician.
Right.
Right, but you have a crisis and what do you do? So that was the gap that was identified by the team, the mental health, the behavioral health collaborative, so that's what that, very similar to a model that's in Lexington and Bedford. So we're kind of excited about that.
Guess who else would be excited?
No,
Dakota.
Oh,
there we go.
Mm.
So I am meeting with the, Sarah, the supervisor, clinical supervisor at Elliott on Monday to hash out, some of the details Dr. Kring asked me about. How will people know about it? Who would they call? What do they do? I don't have answers to that. I anticipate having those answers at the December board meeting. Because she's onboarding, she started Monday and she's gotta go through a couple weeks of training and.
I wonder, I'm on the, I don't know, they rebranded, it used to be called the Community Chest, but now it's something else.
Hmm.
It's the same thing.
Mhm.
That came up because I guess the Community Chest had been funding that gap. And people were like, why doesn't the town have this?
So the town
And
is now
so-
going to have
And
this.
now, so I guess all this to say is I know that. At least last year, I wonder, I don't know if you have a relationship with the the board there, but. There did seem to be a disconnect between their mission. And what services we had available and like how it related to grants, so I wonder if there's a way for. Maybe at the, Randy, at the board you could
Chair's
do the
breakfast, yeah.
breakfast or whatever,
So if you have somebody at the community chest, I will reach out to them. That is
I-
a gap in my,
I
like,
can
people I've
tell
reached
you.
out to, yeah.
Jeff Blue, he's the dude, I'm happy to introduce you.
Yeah, that'd be great, cause I think that I've been, Bonnie Wilbur is the closest, she's the, services coordinator. For the town, she does everybody between 18 and 60, so the COA has a team that does
Mm,
60
Right,
and above.
right,
But
right,
Bonnie, connects, she's a service coordinator,
yeah.
for that than everybody else, if
And
you
it's a
will.
good time because we're about to start, January is when we kick off. All of the review of all the grants that have come in, so
Mhm.
it'd be a good time for you to like just sync up with. that.
Right. The town is not, is subsidizing a position, it still will be. It's $35,000 out of the health budget, that
This
was,
is this mental health person that you're
Yep,
talking about?
but so the remainder will be like, some people have insurance that will be billed, so it's not funding the whole 100%. But it's for the people that don't have coverage and the gap, if you will, so it's not out of pocket, prohibitive for people.
And
Right.
that even might be something that the chest.
Hmm.
So that is a good conversation, because I don't know the data on then how many, like, how much that will be, that's a good. Part of the discussion is like, well, what if they can't pay anything, and how is that gonna work, and.
I guess the other thing too, you'd have to talk about is like, how does that relate to Carlisle? That's the only wrinkle, is Carlisle is part
Part
of
of
the
the community
chest.
chest.
Yeah, so I don't know how that
Hmm.
works, but we do fund Concord specific grants.
Correct. And,
So,
Is that all run by private donation?
yeah,
and that's another good, I gotta write that down, because through the school, I don't wanna exclude any kid that lives in Carlisle.
yeah, that is, I
That
would
is
say,
a tricky one.
that is a big
Hmm.
part of, yeah, and behavioral health.
I didn't think of that.
Behavioral health was like the number one thing that we were tackling last year.
Mhm.
At the chest, so anyway, point of the matter is, there's probably a lot of good synergies there.
where's the Elliott Center now? Is it still in Emerson and the Elliott Building?
Baker,
They-
Baker Ave.
It's on Baker. Okay, good.
Yeah, and one thing too, Melanie, and I don't know, this is probably related to, then I'll stop. It became very clear that the chest had historically funded a lot of things that served the towns. We were funding a lot of grants because of the influx of folks in the shelter.
Yes.
Mhm.
So there became an obvious gap where historically we had been able to fund things and it just like annually had been going smoothly. The chest always funded it. But it was like one of the first years where we were short because there was such a demand.
Yeah.
Yeah, the demand exceeded the
But it,
supply.
a lot of it had to do with behavioral health and maternal.
Very wonderful.
Yeah.
Yeah.
Yeah, that's awesome. All right. I think that concludes does anybody have any questions for me?
You've done a lot.
Yeah.
Wow.
Busy,
Yeah.
yes.
I feel like I'm
Yes.
pretty busy.
Yes.
I feel,
And ICS 300.
yes, I did do ICS 300 and I
Is
did.
there some place that I and Newbie can look up? Does the town have any legal language that empowers the Board of Health and what it says?
If you go do your swearing in, they give you a whole,
I did, it's got the committee handbook, I've gotten that one.
oh, I haven't read it yet. I got it today.
Right there.
Oh,
No,
that.
well,
Yeah.
that, and I've read that, but the committee handbook was more like open meeting law.
Oh,
and
yeah,
that
yeah,
kind of
yeah.
stuff. But I'm thinking like, so when the Board of Health was created, probably, I don't know, there was language that said, here's what your job is,
So that's
here's what you do. here's
Mass
what you-"
general law,
That's the Mass General Law part, okay.
121 chapter, or like, there's a section in the code that says what boards of health to do, and you read the whole
But
section.
not a separate one for us and with separate prescriptions.
Specific to Concord.
Yeah, or
So we
something
have
that town
local
meeting
regs.
did once,
So on our website,
all the
So
local regs.
the local Board of Health regulations that the local Board of Health has already passed, included these dumpster regulations, are under, if you go to departments, go to health. Under regulations, there's our local regs.
Can't wait.
So it's the animal regs, the well regs, the body art regs, those are the new ones, the tobacco. I do get probably 2 or 3 or 4 emails every day from people asking me to not do the nicotine-free generation. They told me not to do this regulation, I'm like, too late, you missed it. But I get a lot of those. It seems to be increasing.
Does Concord have one of the things that, where it issues tickets to stores that sell to underage people?
We do issue fines.
Yeah.
We have so that's our tobacco regulation. And then we have a regulation on, septic that is addition above and beyond the state. So it's Mass General Law sanitary codes that we enforce. I can go through, we get a meeting.
No.
I
Not
could talk a
now,
long
obviously.
time about all the different.
I just
regs
wanted
we're
to
gonna
know
go.
where I could learn.
You know what I found
Many regulations.
Is really good is MEHB has a website.
Oh.
And it's excellent about now, you're a new board member.
It does
Oh,
have some
awesome.
good stuff. That's a good, I
And
forgot about
so-
that.
Thank
Yeah.
someone, when my wife wants to go to dinner, I'm sorry, honey, I'm reading Concord septic regs.
So and it's more state, but it's still really good,
Cool,
like,
thank you.
you know, oh gee, you're. a
Did
new
you want to, public comment? We don't
Oh,
have
yes,
it
I'm sorry,
during the
yes.
meeting.
Yes, thank you very much. Sorry, yes, I see no members of the public present, so we will move on from that, and then I will entertain a motion to adjourn the meeting.
Ooh, can I?
Yes.
Yeah.
I move that we adjourn.
Do I have a second?
I second.
All in favor?
Aye.
Excellent, unanimously adjourned.